All right, good afternoon. Good afternoon. You are welcome to our pharmaceutical calculation lectures, BD 253. We'll continue from where we stopped in dosage calculations. We've actually gone far with this topic. Let's see. We've discussed how to measure volume. Those volumes of less than 5 ml, right? When I said that you can use syringe, right? Oral syringe. Oral syringe. Okay. We discussed how to adjust dosage of drug in a situation whereby the patient has renal problem, right? When the patient has kidney issues, right? Yes. Because most of the drugs are excreted after their work in the body, in the system. They need to be eliminated, right? If not, they will do accumulate and become toxic. So they need to because drugs are xenobiotics. Drugs are xenobiotics. Did I mention this in this class? That drugs are xenobiotics. Did you check the meaning of xenobiotics? Did you check the meaning of xenobiotics? Someone should take it up now. Because they are xenobiotics. Because they are xenobiotics, if they accumulate, they are alien to the system. Most of them are alien to the system. If they accumulate so much in the system, is a problem. So there's need, when they are done doing what they should in system, there's need for them to do leave the system. So the channel, if this is the way through which water should leave maybe after rainfall, this place got accumulated with water, and this is the channel through which they can leave this place, right? The water can leave this place, right? So if this place is blocked, what will happen? Water will do what? It can even get to the extent that it will start overflowing through of us. So that's what happened to the system. When this drug, you take them in, they will do what they're meant to do. After that, they need to leave the system, because most of them are not. They are have you checked xenobiotics? What are xenobiotics? Who has checked? Ada, check your line. Check. So they need to leave the system. If not, they will accumulate and they become toxic. So there's need for dosage adjustment in patient that has kidney problem. Am I completing? You know, if someone has kidney problem, most of the normal function, physiological functions of the kidney will be affected. It will not be 100%. True of us. It will working, but not 100%. So there will be accumulation. So you need to adjust the dose so that there will be no issue. Have you checked it? What are xenobiotics?
It's a chemical substance found within an organism that is not naturally produced or expected to be present within the organism.
Did you hear what she said?
Yes.
There are chemical substances that are what? That are what?
Found within an organism.
Yes. That are not naturally produced by the organism, right? Good. So they are alien to the system. So they need to do what? Do their work and do what? They are visitors. They have to do their work and do what? Go. So that's why there's need for dosage adjustment in patient with kidney problem. I just want to throw more light on that. Okay, let's continue. Most times you give half of the dose. Most of the time you give half of the dose, so that there will be no much accumulation in the system. Now let's continue. So Let me look at this. I want us to. Did I mention drug dosing based on what units? When I mentioned, I think I discussed it in our last class. There are some drugs that are the amount is not measured in milligram. You hear things like what units. I mentioned some drugs like insulin. Most of the enzymes are like that. Insulin is like that. Chemotrypsin. The one you call what? There's this thing. Sorry, did I say chemotrypsin? What am I saying? Don't mind me. There's this one people call what? Chimoral. Chimoral. If you have you ever check the what? The strength. It's not a milligram. It's in what? Am I communicating? Good. Now even some vitamins are also in what? Units. Vitamin A, E, in what? Units. So I want us to do some calculation based on what? Drug dosing based on what? Unit. Actually, these drugs, they have factors. There's this conversion factor you can see used to convert them to what? Milligram, or from milligram to what? Units. But it's peculiar to a particular what? Substance. It's not constant for all substance. It's peculiar to a particular what? Substance. A particular what? Drug substance. Now, these things have been done, calculated and kept for that particular what? Drug what? Substance. The amount of this drug that will give social amount, the amount of this drug in milligram that can give social amount of the same drug in what? IU. It's not a general listen where you say 1 milligram must be what? IU. 1 milligram must be social IU. No. It's not like metric measure, general metric measure, where you say that 1 milligram will give you 1 milligram will give you 1 gram, something like that. So if a particular drug in IU is so units, that same drug has what it will be in what? Milligram. But if you get another drug, it will not be the same thing for that particular drug. That drug, by the time I solve a question on the board, you will understand it. Look at this question. Look at this question. Look at this question. Okay, we actually solved a question, right? Ask. You say you have a question. Okay. We solved the question on that. About nystatin oral what? Nystatin oral what? Oral what? Oral what? Huh? We solved the question about nystatin oral what? Oral drip. Who said oral drip? About nystatin oral what? Was not the last calculation we solved. Now what is that? You came late and I allowed you. Next time you come late, I will not allow you. Don't come late to my class. Do you hear me? There's a question about nystatin that we solved. Tell us. Nystatin oral what? Oral what? All right, we solved the question about nystatin what? Oral suspension. Okay? We solved the question about nystatin what? Oral what? Suspension. Now let's look at the next question. The one that will involve. Okay, this one is okay. Look at this one. Do I write on the board or do I dictate it? Do I dictate? Look at this question. It says a type of vitamin oral drops contains 5,000 units per ml of vitamin A. There are 40 drops per ml. How many drops will provide a child with 750 units of vitamin A? Who can solve it? Who can solve it? Huh? Who can solve it? Who? Who can solve it? I'm going to try fast. Come here. Come this side. Hope you are with us. Huh? The question says that a type of vitamin oral drops contains 5,000 units per ml. Let's interpret that 5,000 units per ml. 5,000 units per ml means that 1 ml contains what? 5,000. So write it. 1 ml equal to 5,000 units. So the ml is the volume, right? Why the unit is the what? The amount, right? So if 1 ml contains 5,000 units, now remember we are told that you will deliver. How many units do you want to give to the child? Then 750 units will be how many ml? Oh yeah. 750 units will be what? How many ml? Find X. So 75 divided by 100 is what? 500 is what? 0. What? 0.2. 0.15 ml, right? So 0.15 ml will contain 5,000 what? Units. Now, what we are asked, we are asked in what? Drops, right? Not in ml, right? We are asked to find it in what? Drops. Now, look at this. Go back to that place. 1 ml contains how many drops? Write it. Therefore, 0.15 ml will contain what? X. So X is what? Okay. What's the answer? It's something I hope you know. Yeah, but I want you to break it down. So there's so that you understand what he did. That's why I ask him to take it step by step. He sees what? Drops. It's actually what? 6 drops. See, do you know this thing you did? See, this thing you did, watch out. Let's assume. Do you know why you got the same result with me? Because that thing is just per ml. There are some questions you will see. They will say that is 5,000 units per 5 ml. What will they do? You see it not work. You see it not work, right? Because 1 is not significant in division, right? And multiplication. That's why it worked. And when you are asked, you are told that it's 5,000 units per 5 ml. So you see that if you try this thing, you make mistake. Okay? So please, if you want to solve something like this, break it down. Take it step by step. Don't muggle it up. Do it step by step. Okay? So that's the only correction I want to make. So you cannot hold in every situation. Okay? All right, let's go. All right, the next question says product A contains 8 milligram of vitamin A as retinyl acetate and 400 IU of egocalciferol, and product B contains 2,500 IU of vitamin A and 10 micrograms of vitamin D. Which product contains the most vitamins? Who can solve it? Who can solve it? Huh? Huh? Remember I told us something. There's something I said before now. I said that they are measured in what? IU, these vitamins and some of these hormones. But vitamins, especially fat-soluble ones, can be converted from milligram to what? Weight to what? Weight in gram to what? Or milligram to what? IU. But it's peculiar to a particular what? Drug. So put this in down. Drugs like substances like vitamin A now. For vitamin A, 1 IU is equal to 0.344 microgram. Vitamin A. For vitamin A, 1 IU is equal to 0.344 micrograms. For vitamin D, 40 IU is equal to 1 microgram. 40 IU is equal to 1 what? Microgram. So with that now, who can solve this question now? With this I just said now, who can solve this question? Who? Nobody. Secretary, come and solve it for us. Huh? You don't want to solve it? Wait, I want to see your face. You don't want to solve it? Who told you that you don't know it? Huh? Come and try. Good. That's the right mindset. That's the right mindset. Let me try. Do something. Don't say you don't know it. Okay? I don't accept no for an answer. You start it and do it first. Don't say you cannot do it. Who can sort on the board? Who? Okay, let's solve it. Our time, we have just 8 minutes to go. Let me solve it so we can dismiss. Okay, look at the question. It says product A contains 8 milligram vitamin A as retinyl acetate. That is the salt form. The salt or form. And 400 IU of egocalciferol, which is vitamin D. That's another name for what? Vitamin D. Actually, another name for vitamin A is retinol. But when it appears as an acetate, you call retinol what? Acetate. But the base name is what? The reason is what? Retinol. That is vitamin what? A. Okay? Good. So this is simply vitamin A and vitamin what? D. The product contains vitamin A and what? Vitamin D. And inside it, vitamin D is 8 milligram Vitamin A is 8 milligram, and vitamin D is what? 400 what? IU. That is product A. Then another product B, contains 2,500 IU of vitamin A and the 10 microgram of vitamin D. Then I want to know which of the product A and B, which of them has the higher number of what? Higher amount of what? Vitamin. That's what they want to find out. Let's go. Let's take solution. This type of question we need to solve it fast. We need to draw in a what? Table, okay? So we can solve everything at the same time, okay? Now, we can draw a table where we have products A and B. Then the two what? Vitamins. So this is product what? This is product what? Product what? A. And this is product what? Product what? B. Who are you? Who are you? This is product A and B. So let's check vitamin A here. Vitamin what? A. Vitamin what? D. Then total. We check their what? Total. And know the one that has higher number of what? Higher amount of what? Vitamin. Let's go. Vitamin A has what? 400 8 milligram of what? Sorry, product A has 8 milligram of what? So here is what? Then product B. Let's continue. Let's finish with product A first. The same product A, hope you're following, has 400 IU of what? Vitamin D. So here is what? 400 what? IU. Then let's move to what? Product B. B contains what? 2,500 IU of what? Vitamin A. So here is what? IU. Then, and the 10 microgram of what? Vitamin what? D. 10 what? Microgram. Vitamin D. This is what they contain. Now, you simply need to do what? Add the amount of vitamins each of them, and know the one that has higher amount of vitamin. But you cannot add because they are in different what? Units. So you ensure that you move everything to the same unit. You can set to move everything to IU. You can set to move everything to what? Mg. You can even set to move everything to what? Microgram. Any one of your choice. You get it. You get the one that has the higher amount of what? Vitamin. True of us. So I can choose to move to what? IU. Okay? Let's move to IU and see what we get. Okay? Let's move everything to where? IU and see what we get. Now remember this 8 milligram. That means we have to move this to what? IU and move this to what? IU, right? 8 milligram. Remember what I told you about converting from IU to milligram. When it comes to vitamin A, what is the relationship for vitamin A? How many IU make how many milligram in vitamin A? Is it microgram? So for vitamin A, 1 IU is what? Good. So vitamin A, can I clean here? So for vitamin A, remember that for vitamin A, there is noise in this class. What's going on? Remember that 1 what? 1 IU is what? Micro what? Is it microgram or milligram? Micro what? Gram. Yes. But we are giving what? 8 what? So let's move let's first move milligram to what? Microgram. 1,000 microgram make one what? Milligram. Okay? 1,000 microgram make one what? Milligram. So because of that, let's now move 8 milligram to what? Microgram. So 8 milligram will now be what? Times what? X. 8 milligram will now be what? 8,000 what? 8,000 what? True of us. So we now move it here. Right? Can I clean here? So remember that but 1 IU is equal to what? 0.344 what? Microgram. Therefore, X will be what? 8,000 what? Microgram. So X will now be what? 1 IU times what? 8,000 microgram over what? 0.344 microgram. Microgram cancel. What's the answer? Divide 8,000 by 0.344. 2 what? 255 what? 233. Huh? One what? IU. 232. Sorry. 2 what? 232. Sorry. 23255 point what? 81 what? IU, right? Good. This is the value in what? IU. For what? This 8 milligram. Are we together? This value for this what? 8 milligram. So we can confidently change it. I can do what? Confidently replace here with what? With what? 2 what? 3255 point what? 81 what? IU. Is it clear? Is it clear? So if you add up this, add the two of them, what is the answer? Sorry, you can add here. You can't. You remember we are talking about what? Yes, you can. Add it. What's the answer? For product A, this plus this is what? 2 what? 55 point what? 81 what? IU. This is the what? The amount of vitamin in what? Product what? A. Let's go to product B. Product B is, this is for what? Vitamin A. And this 10 microgram is for what? Is for what? Vitamin what? D. So we can move this to what? IU, right? So what for vitamin D? For vitamin D, what happened? 40 what? IU is what? 1 what? 1 microgram. True of us? True. For vitamin D, 40 IU is what to what? 1 microgram. Can I clean here? Huh? Okay, question, okay. Is what? 1 what? IU. So 40 what? IU is equal to what? 1 microgram. Therefore, we are moving to what? IU. X is now equal to what? 10 what? 10 microgram, right? Right? So X is now equal to what? 40 IU times what? 10 microgram over what? 1 what? Microgram will cancel microgram. 10 times 40 is what? So we have 400 what? IU. So we can replace here with what? With what? 400 what? IU. So add up. 400 plus 2005, 2009. 2900 what? IU. Huh? Ask.
So this is
Yes. Yes. Because it's not a general thing. It's speculated to that particular word draw. Okay. Good. So if you watch now, product A has 23,655.81 IU. Product B has what? Product B has what? 2,900 watts IU. So which of them has more vitamin? Product what? Product A. Any question? Any question? We are about to end this class. We'll continue next week. Next week we enter pediatric dosing. Okay? Next week we enter what? Pediatric dosing. Please, if you have, as you are coming next week, come with ruler, okay? Come with ruler because we are going to do something. I'm going to teach you how to read a nomogram. Don't worry, by that next week we'll do that. So come with ruler, okay? All right. Any question? So in absence of question, we'll stop here for today. Thank you very much for your attention. God bless you.